Good morning, everyone. We have recorded 30 new cases to 8 p.m. 25 are linked to the existing cases. 5 still remain under investigation. Out of the 30 new cases, 13 were in quarantine during their entire infectious period. Of the remaining 17, we believe 11 were infectious in the community, and we are still assessing the remaining 6 as to how long they may have been infectious in the community. We now have 4 people hospitalised, and we have 1 person in intensive care. Now, I know that this case number today will cause concern. It is a record day of cases for the ACT. It confirms what we know, that the Delta strain of this virus is highly infectious. If you contract the virus, it is highly likely that all the people you live with and the people that you work closely with will also contract the virus. If those people are unvaccinated, it is almost certain that they will. That is the situation that we are dealing with. And that's why it is so important that if you are identified as a close contact, that you isolate. This is how we get the number of cases infectious in the community down to the lowest possible number. This is absolutely critical in our ability to contain the spread of the virus. Vaccination remains absolutely critical in stopping the spread of the virus and protecting our community. Yesterday, more than 12,000 Canberrans aged 16 to 29 registered on the My Digital Health Record website for a Pfizer vaccine at an ACT government clinic. So we again encourage Canberrans in this age cohort to get online and register. We will open bookings in September for vaccinations in October. That's the time frame, the best possible time frame based on current Pfizer supply. 16 to 29-year-olds are a really big age group in Canberra. There's 85,000 of you. 21,000 are already vaccinated as part of the earlier priority vaccination rounds. This means we have 64,000 of you still to go. So the fact is it will take some time based on the available supply of Pfizer, which is why I remind you that the AstraZeneca vaccine is available now through your local GPs and pharmacists. It is seriously worth considering, following a conversation with your trusted health professional, getting the AstraZeneca vaccine as soon as possible. Now, whilst the ACT's overall vaccination figures continue to be nation leading, it is important to remember that it takes about 3 weeks from the day you have the jab in your arm for the vaccines to provide the maximum protection for you. This 3-week vaccine efficacy means that the daily rates that are being reported in our jurisdiction and across Australia do not yet reflect the actual level of protection in our community and in the other states and territories. The 70% and 80% targets that are so often talked about in the national media are important milestones, but they reflect the opportunity to take gentle and measured steps forward in the national plan. They are not the end game, though, for vaccination. So the ACT will be striving for much more than 80%. And we will be including in our goals all those currently eligible for vaccination. This will figure in our decision making on what future public health settings will look like. So that's everyone 12 years plus. They will figure in our decision making, in our vaccination goals and our desire to protect this community. The more Canberrans who are vaccinated, the better protected our community will be from the virus and from the decisions of other governments that are beyond the control of the ACT government. Turning now to business. The detailed guidelines for COVID-19 business hardship schemes are now online. These schemes provide local businesses with up to $10,000 for those that are employing businesses, and businesses that are significantly impacted by the current lockdown arrangements are eligible. Online applications for this assistance will open in coming days. So now is the time to look at the guidelines and get the information necessary to submit your application. All of this information is available online at the ACT Government Business Hub. The government is also re-establishing some of the commercial and residential tenancy protections that were used in last year's lockdown. That work continues and key stakeholders are being engaged on the detail of that now. In the interim, we encourage landlords and tenants to engage with each other in good faith regarding rental payments during this lockdown period. In terms of testing, 5,655 tests yesterday. This is good news. As we've been discussing throughout the lockdown and throughout the pandemic, the more testing we have, the more surveillance we have and the better understanding we have of where the virus is in our community. Our pop-up centres will reopen tomorrow after today's bad weather has passed. So in summary, before I hand to Dr. Coleman to provide some more detailed information on the new cases and the epidemiology, we've recorded 30 new cases. 25 are linked and the remaining 5 are under investigation. And distressingly, we now have 4 people hospitalised and 1 in ICU. Dr. Coleman will provide some further information on this latest set of data. Then Minister Stephen Smith will speak and then we'll take questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. I'm Karen and I'm the ACT Chief Health Officer. As the Chief has said, since our update yesterday, the ACT has recorded 30 new COVID-19 cases, which brings our total active cases associated with this outbreak to 167. Now, I know this figure is really high compared to yesterday and the days beforehand, but it's actually not unexpected. What we are actually seeing now is our household and close contacts coming up from transmission due to the highly infectious nature of the Delta variant, and we have seen this pattern in other jurisdictions at the start of these outbreaks as well. But what this means is it's really critical that Canberrans continue to do the right thing. We really need you to continue to follow those lockdown rules, get tested early if you're identified as a contact of an exposure location, and or experience symptoms. And I'll talk about that in a little while again. So specifically, of these new cases today, I can confirm that out of the 30, 25 can be linked to known cases or ongoing clusters. We know that 21 of the 25 are actually household contacts, and the remaining 4 come from existing clusters. Out of the 30, 13 were in quarantine during their whole infectious period and therefore posing no risk to the community, which is great news. Of the 17 remaining, 11 were infectious during the community for part or all of their infectious period. Now, while this is concerning, it's also important to note that this does not necessarily mean that people are doing the wrong thing. In most cases, people have not been identified as a contact in time to go into quarantine before they were infectious, and we do have a lot of essential workers out there continuing to work in the community. The reason for this is that with the Delta strain, it moves very quickly. We often see the timeline between the first case and the onward transmission of less than a day. Secondly, people actually are infectious for up to 48 hours, so 1 to 2 days before symptoms appear. So this does mean that they're not deliberately doing the wrong thing, but it does really underline the importance of being able to quickly identify cases and identify if you are a contact and immediately quarantine as soon as you get that word. So furthermore, in terms of those 17, the remaining 6, we are still assessing their time in the community. We now have 4 people in our hospitals, and while 2 of these are COVID positive but not in hospital for COVID-related issues, and 1 is receiving care for COVID but doesn't require any intensive support, we now do have 1 case who is newly in intensive care and is receiving breathing support. Furthermore, since our last update, we have over 12,400 self-identified close contacts who we're supporting and over 6,100 casual contacts. We also have almost 400 exposure locations spread across the entirety of the ACT. So as I say every day, please stay up to date on these new venues through the ACT COVID-19 website. Just to provide a quick update on Condamine Court, our multi-agency response team, including our many community partners, continue to be on site providing information and support to all our tenants. We have comprehensive plans in place to manage cases and contacts in a range of high-risk and vulnerable settings, including high-density public housing complexes, and our focus continues to be far broader than just a health response. And finally, just to provide a broader update on the outbreak, we continue to have the 3 additional cases in our surrounding New South Wales region, which are linked to an outbreak but not included in our figures. There is very little change in the breakdown of active cases across our age group, so our age distribution is remaining very similar. Brightbee's Early Learning Centre in Nichols are the 9th public site at which we have detected transmission, with 3 cases now as part of that cluster. Please continue to check our exposure sites on our website, and if you have been to any of these sites during the dates and times identified, please do what is asked of you. And then just finally, my thank you today is to those essential workers that continue to be out there and service the community during this time. I do acknowledge that there is a lot of uncertainty at the moment, and I just want to personally thank you all for continuing to get out there and do your job and provide that support that the community needs. I'll now hand over to Minister Stephen Smith. Thank you.
Thank you very much, Karen. I've got a couple of key messages today about testing and about our health system. So today we have Gold Creek pop-up and Erindale being used for specific testing as we bring our school community groups back for their end of quarantine testing. These are large groups of people who need to get through testing. So today we have Nichols Early Childhood Centre and Gold Creek School going through the Gold Creek pop-up, and we have Lynham High School going through Erindale. And then over the next 2 days, Wednesday and Thursday, we'll have Harrison School at Gold Creek. So I just want to issue a reminder to parents and carers that this testing is for close contacts. So that means students, teachers and staff who are actually on the school sites on the identified exposure potential days. So please, if you are not a close contact, do not seek to be tested if you're accompanying your children to these testing sites. There are a lot of close contacts to get through, and it's really important that we do that in a timely way so that we can get to the next group of people. So thank you very much, everyone, for your cooperation in that. And everyone who is impacted by that will have received direct information about the times available for testing at the different sites. Of course, today's case numbers underscore the seriousness of this outbreak and the infectiousness of COVID-19, and particularly the Delta strain. I want to assure Canberrans that the ACT's health system is well prepared to care for positive COVID-19 patients. As we've heard, there are currently 4 people with COVID-19 in our hospitals, and 1 is receiving intensive care treatment. Canberra Hospital has a dedicated ward for COVID-19 patients, and Calvary Public Hospital is also setting up a respiratory assessment unit to operate as and when required during this COVID-19 outbreak. The unit will provide an area dedicated to respiratory patients who are COVID positive or suspected to have COVID. This means these patients are not placed in short stay or other inpatient wards before their COVID-19 status is known. We're also ensuring, however, that we maintain our capacity to treat patients with complex mental health needs. We know more people seek acute mental health treatment as the lockdown continues, and this is also part of our planning. I want to encourage anyone who does need to seek health treatment, if you have been identified as a close or casual contact and you need to seek medical treatment in any health setting, please ring ahead if you possibly can and identify yourself as a contact at the very first opportunity if you haven't been able to ring ahead and seek advice. Finally, in relation to the University of Canberra Hospital, a team member who works in a support service role at the University of Canberra Hospital has tested positive for COVID-19. Canberra Health Services responded immediately on being informed of the positive case, and all staff members that are close contacts of this team member have been identified and are in quarantine. The team member was wearing a surgical mask and goggles while in clinical areas while they were unknowingly infectious, which means the risk to staff and patients is considered very low. A full risk assessment is being undertaken by the infectious diseases team today. And enhanced infection prevention and control measures have been put in place in the areas where this team member works at University of Canberra Hospital to further minimise any risk. And the interim CEO of Canberra Health Services, Dave Peffer, is here to answer any questions you might have in relation to Canberra Health Services' response to this matter, but please wait until after the Chief Minister and Dr Coleman have taken questions, as Dr Coleman needs to get to AHPPC. Thank you, and with that, I'll hand back to the Chief Minister.
Thank you, Rachel, and we'll start on this side of the room with questions.
Chief Minister, there was some optimism in the community that the curve was perhaps flattening after the last few days of results. That appears to have been blown out now. How much has your confidence been affected by these case numbers today?
Look, it's a high number, but I think it's important to look at the detail of the cases and to understand the reality that, as I mentioned in my opening remarks, that once there's an infectious case in a household, it's highly likely that unvaccinated people in the household will also contract the virus. So we're going to have days like this where that household level initial infection will spread to other members of the household. We've also seen from other jurisdictions that this often happens with close work colleagues as well. The only protection is vaccination. So say to people who are yet to make that decision, please get vaccinated.
Can you rule out more days of case numbers like this or higher?
No, I can't rule anything in or out, and this virus behaves, it's not as if it listens to chief ministers or premiers or prime ministers. No, I can't rule anything out. All we can do is respond to the circumstances that are before us. There are certain factors that are clearly going to influence the number of new cases. The public health settings are the most significant. People's behaviour and their ability to get vaccinated and to stay away from other people are going to be the biggest determinants of case numbers into the future.
confidence in lifting the lockdown, perhaps on the 2nd of September, changed any?
It's still too early to be speculating on where we're going to be in over a week's time. The numbers and the issues that are most pertinent are people's time infectious in the community, and then the public health settings that impact on the transmission potential more broadly. So the reason we are in lockdown is to reduce the transmission potential. So if we weren't in lockdown, then that one case that is now over 160 infected people would be thousands of people infected and the outbreak out of control. So that's why we have the lockdown measures, why we have the quarantine and isolation and the contact tracing, and why we are encouraging people to get vaccinated.
Will this have any bearing on that day 14 figure that you were mentioning in terms of easing restrictions for certain businesses, the case numbers?
Well, every day's data and every individual case and circumstance and the nature of where people are contracting the virus are all significant inputs into that decision-making process. The number of places in the community that people have been infectious, the capacity for those contact points to lead to lots of other people being contracting the virus and then becoming infectious. So it's pretty well guaranteed that if you contract the virus and then you go back home to your household, you're going to spread it to everyone in your household. That's the Sydney experience, and that's the experience that we are seeing in Canberra as well. Well, it's the Melbourne experience, it's the Australian experience, it's the global experience. So that, I think, is important for people to understand, that the people you are most likely to infect unknowingly are your own household, your own family, and that's amongst the most distressing aspects of all of this. And so the only way to protect against that is to get vaccinated.
Will you be looking closely at the fact that a construction site has been labelled as an exposure site to see if any transmission has occurred there as an example for that industry going ahead?
Well, not just that industry, but all workplaces. I mean, this is the experience in Sydney. If you want the real live case study playing out in a very ugly way just up the highway, it's that workplaces and households in close contacts are where the virus spreads. So the best advice around the construction industry is for construction workers, tradies, if you're not already vaccinated, go and get vaccinated. Use this time to get vaccinated. Yes, this over there.
Minister, as we move ahead with the vaccine rollout and now that 16 to 29-year-olds are able to register their interest, can we expect to see any changes to how this next phase will happen? For example, certain groups within this cohort being prioritised, whether that's essential workers who haven't yet been eligible or year 11 and 12 students, for example?
Okay, so most year 11 and 12 students are currently, I think, only able to access Pfizer. There might be some 18-year-old year 12s by this point in the year. So there's, I guess, a different set of thinking in relation to those that are 16 and 17, because they've only got one vaccine that's available to them, although the hope is that Moderna will become available next month. We do have existing programs to prioritise frontline workers in healthcare, aged care, disability care, and as we move through the vaccine program and get more people vaccinated and have more mRNA vaccine supplies, Pfizer and hopefully Moderna, that will allow us to open up vaccination to more people and then to be able to have the detailed consideration of prioritising within those age groups. But we can't really do that until we have the vaccine supply of the mRNA vaccines. AstraZeneca is available now. So if you are a teacher or in any other category where you have a public-facing role and you are concerned, you can have that conversation with a trusted health professional, a GP, a pharmacist, a nurse practitioner, and get the AstraZeneca vaccine. Or you can register through the ACT government program to receive a Pfizer vaccine, but you're not likely to receive that Pfizer vaccine based on current supplies until October, probably mid to late October, unless more supplies become available.
I know you're probably always constantly pushing the feds for more vaccine supply, but have you really ramped up these efforts in the last few weeks? We've seen, there's extra Pfizer doses have been given to New South Wales and Victoria. Are you saying it's time for the ACT to get those doses?
Yes, I've said that more than once, yes. And the Commonwealth have been able to help at a very small level. I mean, the point I make to them is a small number of doses goes a long way in a jurisdiction of our size. So we are engaging with General Fruin, who is in charge of the vaccines, to see whatever opportunity there is to bring forward some additional supply into the ACT.
Chief Minister, what do you make of the federal government's support measures they've announced for childcare centres?
Well, I think they're important. I welcome them. Again, it would have been great if they'd been put in place, a couple of weeks ago, really.
What's your message to people in the community about sending their children to childcare centres? We know so many people rely on them, particularly people in essential services.
Yes, that's it in a nutshell, that for some households it's their only option. For others it's not, so it will clearly depend on the circumstances of the individual family. But it is good to see that the Commonwealth have stepped up with this additional support, and when the Treasurer rang me yesterday to indicate that they would be making this announcement and that the ACT would be included, I thanked him and was very grateful that that support has been provided. As I say, it would have been even better if it was a week ago, but the next best time is now, and so that's good.
The number of childcare centres now as infection sites, including a site that has been transmission. Is there advice for parents to second guess sending their children if they need to?
Look, I'll get the Chief Health Officer to address those specific issues. I won't dispense advice I'm not qualified to give, but what I would say in all of these contexts is that vaccination, particularly for parents in this instance, obviously there aren't vaccines available for kids under 12, but for parents, if you can get vaccinated, please do.
Our questions for the our remaining questions are for the Chief Health Officer.
Okay.
So.
Terrific. All right. Thank you very much. Dr. Coleman will step up to answer questions now. You can ask something as well.
Cho, are any cases linked with the disability cluster, and are any with the Cocoa Republic construction site?
So 2 of those 30 cases announced today are additional cases in the disability cluster, so another 2 in disability support workers. And the second question, I do not believe so associated with that exposure site, but I'm not 100% sure about that.
Of the cases that are in hospital, are you able to say how many of them were vaccinated, if at all?
Look, unfortunately, the lady in intensive care is unvaccinated, but I don't have the details on the others. So I think I would just reiterate the Chief's key message every day is that if you have access to the vaccine, please go out there and get vaccinated.
The Chief Minister was just talking about the supply of AstraZeneca and telling people to go get that. Has your advice changed now? Would you be saying people should just go get AstraZeneca, people under 60 that is, if they can?
I'm not sure that my advice has changed in this space. I think we've always talked about this being a risk-benefit discussion that individual people need to have based on what the current risk of exposure and infection in the community is to their own individual circumstances. And their general practitioner or their pharmacist or their nurse or their trusted health provider is the person who knows them best and is able to have that conversation with them. So please reach out, have that conversation and make that decision.
Sorry, to bring you back to the cases that are in hospital at this time, can you give us any information, obviously conscious of the privacy concerns, about the demographics of these people, who they might be, what sort of age ranges are they from?
Just let me check. I don't know that I actually have details on all of the cases, but I do know that the lady in intensive care is in her 40s. But noting that all of our cases, 85% are under 45 years of age, we do have a very high proportion who are younger.
And of our total cases, how many are vaccinated?
So I don't have that detail in front of me, and I am aware it's of interest, but I will just say that again, that a large proportion, 85%, are under 45. They've been eligible for vaccination for a lower amount of time, so we expect a high proportion to be unvaccinated.
You mentioned the cases are expected to, hit these kind of record numbers and then drop and things like that. Is there a time up to 14 days when we can expect to see that? What are you kind of looking at in terms of that?
So we'll see this wax and wane as we move forward, as we see secondary and tertiary and even fourth generation transmission as we move from household contacts to the next level of contacts. And we just have to monitor and see at each stage how much exposure there is and therefore how much transmission there is going to be. It's really difficult at this point to say, but I do know that at this point in time, this doesn't surprise me, and I think we just need to keep a tight eye on it, keep asking people to do the right thing as we've been advising, and hopefully we'll see those ebbs and wanes gradually trending down.
Panic stations?
Oh, certainly not. Please, people, do not panic. We are heading in the right direction, and the number of people I'm seeing who are engaging with us, getting tested, staying in quarantine is really fantastic. We just need to keep doing it for quite a bit longer. But I'll come back to you every day, myself or Deputy Vanessa Johnston, and have this conversation as long as we need to.
We're seeing exposure sites listed with dates that were 2 weeks ago. Are you worried that perhaps people who were at that time have been in the community for 2 weeks? And as a result of these being listed as exposure sites, does that mean you've picked up undetected chains of transmission as a result of their listing?
So I think, so I'm not sure if we've actually detected at this point in time a previously undetected chains of transmission, but you're exactly right. That is the point, that we need everybody out there from those exposure sites to come forward and get tested to give us the best chance of detecting those.
Of the exposure site aid childcare centre, are you able to say, is it children that are becoming infected? Is it workers, parents?
No, I'd prefer not to give any details about that, but I actually think it's just really important that all those groups are potentially at risk of transmission and need to take the relevant precautions.
What's your advice to parents thinking about sending their children to childcare? Should they second guess that decision given the risks involved, particularly with these exposure sites?
I think that's a very personal and individual decision for parents to take, and I recognise that many of them are essential workers and absolutely, as I mentioned in my discussion, need to get out there and do that work. I want them to feel comfortable and safe that they can take their children to childcare. We work with childcare and schools and all of these places to make this as safe as possible, so please be encouraged that that work is going on. But as I've said before, I can't 100% promise that you won't be exposed while we have virus circulating in the community. So continue to do those things that you know that we need to do to reduce the risk. And please, for those of you who are eligible, consider vaccination.
Can you provide an update on the number of cases linked to each of those 9 transmission sites?
To go through the list? I certainly can. So we have, as mentioned before, Bright Breeze Early Learning Centre, 3 cases. We still have 2 associated with Gold Creek School, 11 with Downer Community Centre, now up to 30 at the Fiction Nightclub, 4 at the Assembly the People's Pub, 15 at the Lennox Jaguar Land Rover dealership, 40 now associated with the Lyneham High School, 6 Belconnen Basketball Stadium, and 27 at the Southern Cross Basketball. So basketball seems to be quite an activity of promoting transmission.
And do you have an update on the number of healthcare workers that are in quarantine?
No, I'm sorry, I don't have that. Minister might have some more information when she steps up, but I don't have that.
How about the general population? How many people are we seeing in quarantine now?
So as mentioned before, we have over 12,400 close contacts in quarantine. We have 6,100 casual contacts, and we generally have around 2,000 who are in quarantine for another reason. So let me get you the total figure on that. It will be the last page, won't it, in my report? So we have a total of 14,600 people in quarantine. for all sorts of reasons.
Do you expect that number to grow given the large number of new cases?
Oh, look, I think it will, as the other one, wax and wane. So we're seeing people come out of quarantine associated with the earlier pre-existing exposure locations. But I think that we will gradually see that number decrease because due to lockdown, the new exposure sites won't have as many people associated with them. So there will be less people going into quarantine. And that's exactly what we're trying to achieve. Less people in quarantine, less people at risk from a close contact perspective, less cases coming out of that.
It's a shockingly cold Canberra day today. People probably don't feel like going out and getting tested, particularly if they've got COVID symptoms. Are you concerned that there might be a drop today in the number of testing?
We have a lot of people being tested as part of their cycle, their day 12 to 13 cycle, as Minister spoke to. Look, I think Canberrans have responded really well over the whole course of this conversation that we've been having with getting tested if you've got symptoms. Please, if you've got symptoms, come out to get tested. This is part of our surveillance. This is an important part of us being able to detect a case if it's there in the community.
You've said previously it's not your priority, but are you any closer to working out how this got to Canberra in the first place?
We continue to work through that, and that includes any undetected chains of transmission that come from that. But at this point in time, we have all the information available in the on the public website, and that people need to keep checking back to the exposure sites.
As the previously identified first case, is that still considered patient zero?
We still have a cluster that we're investigating at the very start to see if we can still identify if there are any unidentified chains of transmission that continue to come off that primary cluster.
Just to clarify as well, sorry, were there any further cases linked to Condamine Court?
So we have had one additional case associated with a very close contact of the first case, and we're continuing to work and support that case in isolation. Thank you, everyone. I'll hand over to Minister.
Thanks. I think there was a question about the number of healthcare workers who are currently in isolation or quarantine. So there are still around 700 staff across Canberra Health Services and Calvary Public Hospital who are currently in isolation or quarantine and therefore unable to come to work. But team members have started to move out of quarantine and self-isolation, and some people have started returning to work, which is really great. And of course, the teams are working together to bring people back to the workplace when it's safe to do so. Really pleasing to say that the initiative to recruit Canberra nurses back into the workforce from either non-clinical roles or if they have maybe retired or moved on to something else has attracted more than 500 people. So I really want to thank those people for putting their hands up and wanting to be part of the COVID-19 response in the ACT.
I guess when those 700 people come out of quarantine, is the plan to keep those 500 people on as well? So, I mean, is that going to help with the healthcare capacity?
So, yes, so part of our recruitment is obviously to meet the ongoing challenge of continuing to run our health system, continuing to run a COVID-19 response, which will be required across testing and, of course, across vaccinations. So we're also working to recruit students, but I might ask Dave Peffer to come and talk a little bit more about some of those workforce issues, if that's all right.
Good afternoon. So we are in the process of onboarding a considerable number of workers to come and bolster our frontline response to the COVID pandemic. At the moment, we have the majority of those workers in the clinical space. So we're deploying them to our testing effort, also as we look to scale our vaccination effort. But there have been team members as well that have been able to backfill clinical team members in our hospitals, as we've had to stand up and deploy teams out, for example, to Condamine or to LDK Greenway Views.
The case at the UC hospital of a worker there, will that impact services at that site?
No. So I'm happy to give a little bit of background just in terms of what's happened on that site. So 6:30 p.m. yesterday, we were notified by Public Health of a COVID positive individual who had unknowingly worked during an infectious period for 3 shifts across the 20th, 21st and 22nd of August. That team member works in our food services area. We immediately deployed our infection prevention control team as well as infectious disease experts to review the activities that team member had undertaken and identify any potential contacts. At this point in time, the risk assessment indicates that the likely transmission risk to patients or to our clinical team members there is very low. However, there was an elevated risk of transmission to other individuals who worked in the food preparation area. As a result of that and identifying all those close contacts very quickly, 15 team members have been moved into quarantine and are currently in the process of being tested.
Has there been some sort of deep cleaning process occurred as well at the site?
There has. So in response to that, overnight we had a terminal clean undertaken of the food preparation area, and that's now back in operation. There's been no impact to service because of that. There have been other back-of-house operational areas where the risk of transmission has been identified. Those areas we now classify as red zones. We've established them as red zones overnight, and all team members have been advised of those red zones. It does require that people wear full PPE when moving into and out of those zones. They need to don and doff appropriately. Terminal cleans are underway in those zones at this point in time. What I will say though is that it's a timely reminder for all of us, particularly in the healthcare system, but also the broader community of this is why we ask people when they're coming onto our sites, onto our hospital campuses, to wear masks appropriately, and why you'll also see our team members wearing not just masks but full face shields whenever they're in clinical areas near patients or members of the public.
Just back on that 500 people coming into the workforce, the people that re-registered, how many are actually able to do clinical work given there is a fee to re-register for that purpose?
Yeah, so there's a mixture of people that are coming back. Some people do still possess a current registration, so we are able to deploy them reasonably quickly into a clinical role. But I don't have the exact numbers in terms of the 500 who've put their hand up. At this point in time, though, I understand we've onboarded in the order of 100 of those 500 who've put their hand up, and we'll continue to onboard more and more team members to help bolster the response. The majority of those have been in clinical disciplines where people have applied.
I had some further questions for the Health Minister, if my colleagues are satisfied.
Unless you're answering questions on Canberra, or will that be the Health Minister?
Probably next. We'll see.
Minister, at the ANU, there's been a number of students who were in quarantine at the lodges. We've heard that there were students refusing to get on buses to go and get tested. Are you satisfied with the testing arrangements there? Could you implement similar testing arrangements as seen at Condamine Court instead?
So our health team work really closely with ANU to manage the response for students there, and I'm confident that ANU is managing this very, very well. They have expertise within their team to support their own management of their students, and if they need support from ACT Health, they're working very closely together. So we will work with them to provide any support that they need, but they have significant expertise within their team, and they have received advice from ACT Health as well throughout the planning as well as the implementation of their response.
Could that support include on-site testing?
Look, if that is required, then we will obviously work through that, but I understand that ANU put in place its own arrangements and that those were appropriate. But again, ACT Health will continue to work very closely with ANU, and I'm not going to second guess what those arrangements might look like.
In terms of the progress on the new testing facility at the AIS Arena, we've heard previously that there were some fire hazard concerns, things like that. Presumably you're addressing those before people are allowed in to get tested?
Yes, so obviously we're addressing any both work health and safety issues and potential safety issues to the public, but this is a very different use of that space. It doesn't require the lighting around the arena that would be required for a big sporting event or entertainment event, and of course you don't have the crowds all in one place at one time. You'd have people moving through the venue in much smaller numbers than you would for a big event. So obviously we would not be intending to use that facility if it couldn't be done safely.
Just on the Calvary ward that's being prepared for a possible COVID respiratory ward, can you just talk me through the reasoning behind flipping that particular ward?
It's really about the configuration of that space and the ability to ensure that people can be supported appropriately in a location where it has a separate entrance away from the emergency department but reasonably close to the emergency department, so people can be diverted to that space, but also just the way internally it is configured, it was deemed to be the most appropriate space to set up for the respiratory assessment clinic.
Does the addition of this ward kind of cancel out any possibility of Garran Surge Centre being flipped back to a COVID-19 emergency department?
No, we continue to plan for all contingencies. Obviously, Garran the Surge Centre was designed as a surge centre to become effectively an emergency department specifically to respond to either COVID positive or suspected COVID patients. And we continue to maintain a range of contingencies around that should it be required. But at this point in time, it's doing a fantastic job as a vaccination hub, and I just want to reiterate the Chief Minister's and Dr Coleman's encouragement for anybody who can currently get access to a COVID-19 vaccination to please do so.
Minister, we've heard that the clinical workforce is being bolstered by around 500 extra staff. As things wear on with this lockdown, are we likely to see calls for other members of the community who maybe don't have a medical background to come forwards and help with other elements of the response?
I think this is a really great opportunity to give a shout out to all of the volunteers who have already been supporting the frontline response, whether that is the SES and community fire units who've been supporting the people in lining up for testing, helping that traffic management and support for people while they're waiting, or the community fire unit people and other volunteers who have been supporting our contact tracers. St John's Ambulance has provided a number of volunteers for us across the system. So there have been a range of people. The SES, of course, also supporting the delivery of food to people alongside volunteering ACT. So there are a range of volunteers already supporting our system, as well as a range of other people who have stepped forward across the ACT public service. And of course from Defence, we've had 16 Defence personnel supporting our testing efforts as well. So we've called on people from right across our system to do a range of activities, both paid and volunteer, right across the public health response. And I really want to shout out and thank those people who have put their hands up to help. We have needed all hands on deck as this outbreak has continued.
Just on that, how is the frontline workforce coping as we go into another big week of testing?
Look, I think it's busy. It is absolutely busy, but morale seems to be good. People are, they're working hard, but they know that they're doing it to protect and support their fellow Canberrans. And so that really gives people a motivation to keep up the work. And of course, within the ACT Health Directorate, within Canberra Health Services, right across the public service and in our community partners, people are working really hard to support their own staff as well. We know this is a really stressful time. The staff who are coming to work, as Dr Coleman indicated, there are a lot of essential workers who are coming to work every day. They're not staying at home with their families. They're out and about in the community where we know that there is local transmission of COVID-19, and that can cause stress and anxiety for people. And so there's a lot of work to also support people to feel safe and to ensure that they're able to go about their work safely and with that moral support as well.
How are residents at Condamine Court ensuring that they get appropriate groceries, medical supplies and all of that? And will things such as dietary requirements and all of that be playing a part of, assisting these 70 or so residents in their 2-week quarantine?
Yeah, so there's a cross-directorate team who's working to support the tenants at Condamine Court, and we know this is a really difficult and stressful time for those tenants. So the Community Services Directorate, Canberra Health Services, ACT Health Directorate, Emergency Services Agency and Policing are all working together to coordinate support for those tenants and along with our community partners. So I really want to give a shout out to the community organisations who have really strong relationships with some of the more vulnerable tenants at Condamine Court, who have really helped to provide very clear advice about how to support and engage with those tenants. So today, Canberra Health Services has staff on site from across alcohol and drugs and mental health as well, to ensure that people have the clinical support they need. The Community Services Directorate is working, including through their emergency food relief mechanisms that already exist, to ensure that people are getting both the food and the sanitary support that they need in order to maintain their quarantine.
And will there be any nightly patrols or anything of that site throughout the 2-week quarantine?
Sorry?
Will there be any nightly patrols of that site throughout the 2-week quarantine?
Look, we're working through exactly how people are supported to maintain their quarantine. We know that that is going to be a difficult thing for many in that community to do, as it is very difficult for anybody in the community to quarantine. And I do want to take this opportunity to thank all of those thousands and thousands of people across the ACT who are in quarantine. It is very difficult, and fingers crossed in the next few days we'll see thousands of those people being released from quarantine as we finish those tests. It's no less difficult, and in fact sometimes more difficult, for those people at Condamine Court. And what we're really focused on doing is providing a person-centred response that supports people to maintain their quarantine.
And just on sharing places, are you able to confirm that that is linked to the disability care, that was listed as an exposure site? Are you able to confirm that was linked to the disability care cluster? And why did it take 2 weeks for that casual exposure site to pop up on the site?
So that probably would have been a better question for Dr. Coleman. I'm not able to talk specifically around that. I can confirm that Sharing Places is one of the 5 disability organisations that we talked about on Sunday when we identified that this cluster, and said there were 5 providers that were related to this cluster. But what I cannot say is whether this specific exposure site is related to this cluster. It may have been identified through a completely separate case. So I really can't comment on that, and we'll get some further advice for you from Dr. Coleman and the team.
A final question for the Chief Minister, if I could.
Yes?
Chief Minister, again on childcare centres, we've heard that many childcare centres aren't waiving the gap fees for parents. Given the supports in place for those businesses, should they be doing so to ease the pressure on people in the community, particularly those who have no other option but to send children to childcare?
Would have thought that would be the right thing to do, yes. Okay, thank you.